Hello, welcome back to the channel. I'm Lisa.tayloraustin, licensed psychotherapist and expert witness. And today I have two very special guests with us. I'd like to welcome Mr. Michael Baldwin, an EMDR client, and Dr. Deborah Korn, a certified EMDR therapist and consultant in Massachusetts. Just to be clear to our viewers, Michael was not and is not a client of Dr. Korn's, but the two have collaborated with one another as authors. And both Michael and Dr. Korn are the authors of Every Memory Deserves Respect, a book about EMDR therapy. And it's a very insightful book for those interested in EMDR and those who want to read about EMDR before actually trying it in therapy. And the link to the book will be in the description of this video, along with Michael and Dr. Korn's contact information. So, welcome. Thank you so much for joining us today.
Thank you for having us.
Thank you, Lisa, for having us.
Of course. Dr. Korn, in the book, you discuss how trauma leaves fragments of memory in our brains. Can you talk a little bit about this and explain that to us?
Sure. Well, on a day-to-day basis, for the most part, we process experiences without difficulty. For example, we go to a party, right? We see our friends, we eat good food, we make conversation, and we return from the party. We maybe talk with our partner about the party. We go to sleep at night and we dream about the party, perhaps, maybe we write in our journal about the party, but by the next day, we have processed through the experience and it goes up on a shelf. We put it to rest. The past gets moved into the past. However, under traumatic circumstances, something very different seems to happen. Traumatic memories seem to somehow get frozen or locked in the brain, in the nervous system, with all of the components of the original adverse experiences, the images, the feelings, the sensations, the thoughts associated with the traumatic event. The memory doesn't get integrated or consolidated, but instead it remains as a constellation of fragments. And the brain's information processing system is unable to digest the experience, and other information held elsewhere in memory doesn't get connected in. It doesn't get integrated to help a person make sense of the event. It doesn't get metabolized or resolved, and it gets stored in this unprocessed, fragmented form. And then along comes a trigger, an experience that is somehow reminiscent of the original traumatic event, days later, weeks later, maybe even years later. And when you get triggered, the traumatic memory gets activated. The past becomes present. And people lose their adult present day grounding and perspective. Suddenly, you're feeling like you're 5 years old again, growing up in a chaotic alcoholic family, feeling scared and powerless. Suddenly, you're feeling frozen and you're unable to think clearly or make decisions. And sometimes all of the fragments of the memory get activated, and the result is full-blown PTSD, post-traumatic stress disorder.
Mhm.
Intrusive symptoms like nightmares or flashbacks or body memories, pain or panic, overwhelm, sleeplessness, startle response, but sometimes only a single fragment of the frozen memory gets activated. A thought like I'm not good enough, or a feeling like profound grief, or a felt sense of deadness or aloneness inside. This may look and feel much more like depression than PTSD when just one fragment gets stirred up inside. And, we know that sometimes when distress associated with these activated memories becomes unbearable, people turn to their own solutions, to drinking, to drugs, to self injury, to other behaviors to soothe themselves, to avoid, or to numb out. And often, when only some of the components of the memory get activated, folks don't even know why they're feeling the way they're feeling. And they don't connect their current state to past traumatic experiences. They just know that it's unbearable. And Michael talks a lot about this in our book, his experience of feeling stirred up or feeling reactive and just not knowing that what he's feeling in the present is connected to experiences earlier in his life.
I hear this a lot when people say all of a sudden they got a panic attack out of nowhere and they're very confused by it. Nothing happened. I don't know why I got it. So, can you tell us what EMDR is?
Yes. So it's EMDR stands for eye movement desensitization and reprocessing. It's a mouthful. Let me see if I can break it down a bit. Desensitization refers to the reduction of distress, the reduction of fear, anxiety. Reprocessing refers to the reevaluation or the restructuring of thoughts and beliefs and the transformation of one's sense of self relative to past traumatic experiences. It's about moving the past more fully into the past and arriving somewhere new, reprocessing and arriving somewhere new in the present. Then there's the eye movement component. Now, Francine Shapiro, the developer of EMDR, discovered that purposely moving your eyes horizontally back and forth while focusing on a traumatic memory leads to a reduction in the vividness and the emotional intensity of that memory. She developed an effective protocol for treating PTSD and trauma-related problems using this bilateral or back and forth stimulation, and this back and forth eye movements, and published the first research study on this approach back in 1989. She worked with rape survivors and Vietnam combat veterans at the time. So hence the name eye movement desensitization and reprocessing. Now, EMDR is a memory-focused psychotherapy that helps people deal with the impact and the legacy of trauma and adverse experiences in their lives. It's based basically on the idea that psychological problems are related to a failure to adequately process traumatic experiences and memories. So unprocessed traumatic memories, again, frozen or locked in our nervous system, continue to affect how we perceive things, decisions we make, reactions we have, and the beliefs we hold about ourselves and others. And as I explained, present-day triggers activate these unprocessed traumatic fragments, these unprocessed traumatic memories, leading to symptoms that cause distress, ongoing distress. And in EMDR therapy, we help clients access and activate their unprocessed traumatic memories with a set of focused questions and then jumpstart the brain's information processing system using bilateral stimulation, having the client focus on fingers going back and forth, or tones going back and forth, or a light going back and forth. With the EMDR reprocessing, a client's distress eventually decreases and relevant adaptive pieces of information located in other parts of the brain, helpful present-day adult perspectives get integrated. Ideas like, it's over, that was a long time ago, I'm safe now, I was only a kid doing the best I could, it actually wasn't my fault, I'm in control now, I have choices. These are some of the beliefs and concepts that emerge in the course of reprocessing as we move the past into the past. So basically, there are shifts in thoughts, feelings, behaviors, and physical sensations over the course of reprocessing. Healing involves spontaneous movement toward more positive thinking, more manageable feelings, and a significant reduction in the level of distress and disturbance experienced in one's body. And the theory behind EMDR argues that the mind can heal from psychological trauma in the same way the body heals from physical trauma. We are all physiologically geared toward the achievement of optimal health.
What a stellar explanation. That is the most comprehensive explanation I have heard from anybody. So thank you for that. And our viewers, thank Dr. Korn for that, because that was very good. Michael, we haven't forgotten about you, but Dr. Korn, first I want to ask you before we jump over to Michael, could you give us maybe a brief example of a client that maybe you worked with in the past or clients you've heard about that others have worked with where EMDR might be helpful to them in terms of this locked nervous system?
Sure. During the height of the pandemic in 2020, I treated a married young man, a doctor in his late 30s, who was working on a COVID unit. And for months at the start of the pandemic, he was working round the clock with inadequate supplies, limited support from hospital administration. And despite his heroic efforts, he lost many, many patients to COVID. And he became more and more depressed and developed PTSD symptoms related to the unexpected deaths of a few patients. He had nightmares, he had intrusive images, hypervigilance, extreme irritability, while also simultaneously describing this sense of feeling dead or numb inside. And he also found himself throwing things in fits of rage. This behavior was very uncharacteristic for him, and it really frightened his wife. He was unable to sleep. He was unable to concentrate. He was unable to make decisions. He started to drink excessively to try to get to sleep
Mm,
and to manage the intrusive PTSD symptoms. And but interestingly, the powerlessness and the guilt that he felt was quite reminiscent of what he had experienced growing up in a family where his alcoholic father regularly beat his mother. There was little that he could do to protect her. He felt continually responsible for the harm inflicted on her. And he used to throw things like pillows or books at his father while hiding behind the couch to try to get his father to cease and go away and stop his
mm,
violent behavior. So he eventually took a leave of absence from his job at the hospital and he sought treatment with me. And over the course of several months, we processed memories from the hospital and from his childhood related to this sense of powerlessness, guilt, and despair. His PTSD and depression were completely eliminated. He stopped drinking. He was able to return to full-time work. We targeted the memory of helplessly throwing things as a child at his father, and lo and behold, his uncharacteristic behavior of throwing things in fits of rage ceased. And by the end of treatment, he had a sense of deep compassion for himself that never existed before. He was very hard on himself. He was a perfectionist. That had all really softened. He was just generally calmer, more present, and really, by the time he left treatment, he was extremely committed to self-care and to really pacing himself and letting other people in to support him
mm.
forward. So I like to talk about this case because it captures how we can work on both recent adult trauma, but also what might be underneath it, what might be fueling it, why one person who experiences a trauma present day may be able to move through it and heal on their own from it, whereas other people who have trauma from earlier times in life, it's a more complicated picture and they might need to seek help to really clear out all of those channels.
Thank you for that. And I hear those types of stories from quite a few people in the medical profession, especially those who worked in hospitals. So I'm glad it was helpful to him. Michael, thank you for being so patient. You were a very successful leader in the communications industry for decades, right? And am I understanding correctly? You even worked with Steve Jobs.
I did. He was my client for what, 3 years. Then I stayed in touch with him until the end.
Wow. That's, I think, pretty impressive. So you were successful at work, very much so, but at some point you decided you thought you might want to go to therapy. And I'm wondering what led to that decision.
I think I was looking to see if Debbie was smiling when you said that. I decided. So for your audience, just a quick little background. I got pretty much as in early adulthood on an achievement treadmill, a status and achievement treadmill, becoming a status and achievement junkie. For example, I was determined to get into medical school, but then I didn't go to medical school, but I'd gotten in. Then I was determined to get into advertising, and I got into advertising. And I very quickly I was in account management and advertising, and then I had a string of running every global technology account there was to run. And my long-term goal was to work at an advertising agency called Ogilvy and Mather in New York, the New York office, their flagship office, which I did. I got there in 1995, and I was the worldwide account director on the IBM business, which is the biggest, at the time, the biggest piece of business there was in the advertising business. So I was feeding my status and achievement junkiness. And what happened was in the advertising business, if you're on a piece of business and you're an expensive person in the agency, it's great. But if you're an expensive person in the agency and you don't have the music stops, there's no chair for you to sit down on, you don't have a piece of business that you're running, then unfortunately you're expendable. So I was laid off at Ogilvy and Mather, which for me was like going off a cliff because it was my work family, it was my whole identity, how I saw myself, everything about my own self-perception and worth revolved around work and my career, and my apartment and my car and the club I belonged to. So when I was laid off, the wheels just came off. And I cut kind of in a sort of a race to the bottom and made a lot of bad financial decisions hastily and sold a lot of stuff, sold my apartment, sold my car. A lot of really bad financial decisions at the time, but it was not a decision I made when I finally sought out my therapist. And you said earlier, Debbie was not my therapist. She's my co-author, Dr. Jeffrey Magnavita. It was the first time I'd come across or been exposed to EMDR therapy. And it was the first time I found out about trauma and that I actually was a trauma survivor.
That's, I think a route that a lot of people take where they're on a treadmill, right? And
Yep.
their life is going along until suddenly something happens to them. In the book, you talk about enduring bullying as a child, and your home life wasn't exactly grand and wonderful. And you just said that you weren't aware that you had really endured trauma as a child. Was this kind of like a revelation where he peeled back layers of an onion, so to speak? Or is this something he told you? How did that kind of awareness kind of come to you?
Well, to fill in a little again for your audience, I had an older brother who was a really, really serious bully growing up, my whole growing up. And then I had in school, there was a bully in our class who would target me, and when I was in school, um, started in third, fourth, and fifth grade, which anyone who's listening who's had anything that had ever had to deal with being bullied, you basically live in a state of terror. You never, ever, ever feel safe. And it's a horrible, horrible way to live, to try to live. But for me, um, I didn't think my situation was out of the ordinary. I did not make a connection between, for example, my growing up, part of my trauma history was neglect. And I didn't think, and I don't think people recognize that neglect is a form of trauma, a serious form of trauma. And that turned out to be one of the more profound aspects of my own trauma history, starting from, probably pre-verbal. And this all was brought, this is a part of the discovery process through EMDR with Dr. Magdavita. And for the most part, again, I just thought that, this is my situation, wasn't out of the ordinary. I didn't know about trauma. I'd never heard about EMDR therapy. And I had spent over the course of 22 years and 7 different therapists starting in third grade. Um, no therapist had ever talked to me about trauma, and none of them were EMDR therapists.
I hear that frequently. Dr. Korn, do you hear that frequently as well?
Hear it frequently, all the time. I just wanted to add something that, I think Michael showed up for therapy with Dr. Jeffrey Magnavita, and Dr. Magnavita started where Michael was, which was he was experiencing acute symptoms at that
Mhm.
point in time. He had suicidal feelings. He was abusing substances at that point in time. He was, severely depressed, disorganized. And Dr. Magnavita started with the symptoms in the present and started to float back feelings and beliefs and experiences in the body. And I think it was through that process, like inviting Michael to notice what he was experiencing internally and following that back over time and integrating that with EMDR processing, that led to the emergence of an awareness that what Michael had endured, both what happened to him and then the experiences of profound aloneness and overwhelm and neglect, that just became clearer and clearer through the body, through emotional and body-based experience that emerged through EMDR processing. So just to clarify, how it was that Michael himself started to say, wow, I have been through something significant and I never registered it in that way before.
The body keeps the score.
Yes.
So, Michael, I see you shaking your head in agreement with that. We know that children who undergo complex trauma, often later in life, develop a very powerful attraction to familiar personalities that they had in their childhood. So, for example, if they had on this channel, we talk a lot about narcissism. If a person had a narcissistic parent, they're often drawn like magnets to each other when they meet another narcissistic person. Did you find that your interpersonal relationships before EMDR were reenacting any old scripts from your childhood?
Well, for me, a couple of the more profound things were, one was was phobic, having phobias. One was a phobic inability to use a public restroom as a boy, starting when I was a boy. One was a serious panic-inducing phobic reaction to any kind of intimacy with a woman, um, difficulty trusting, uh, and I did have one experience with someone who did not treat me well. And because I was raised to be good and compliant and, didn't know how to set boundaries or to take care of myself, I was, really taken advantage of. And I would say that sort of meets the criteria of your question. Uh, and again, all of this was before I really knew what was going on.
Right, right. Um, so you're in therapy and you're talking about a lot of things and later started using EMDR to process a lot of things, but the realization comes in stages, right?
Yes. And I think that has to do with the expertise of the practitioner, so that knowing what I know now, I think it would have been very easy to have gotten overwhelmed or flooded. But the practice of one foot in the present and one foot in the past, with the complete trust of the EMDR therapist, who is keeping you in your window of tolerance, all that was very much in operation with my EMDR work with Dr. Magnavita.
Very good. Dr. Korn, can you share with us what Michael just talked about, the window of tolerance, and why in EMDR therapy it's so important for clients to stay within that window of tolerance?
Yeah. So the window of tolerance is a concept that was first articulated by psychiatrist Dan Siegel in 1999, and it refers to the idea that there's an optimal arousal or activation zone in the body, a zone where you're connected to the body and you're connected to your emotions, and you can still think clearly and speak clearly. And in this zone or this window of tolerance, you're fully present and oriented, and you're emotionally regulated, right? You can mindfully observe what's emerging internally. So as images or thoughts or feelings, sensations emerge, you can notice without feeling overwhelmed or shutting down. Now, many trauma survivors get stuck in patterns of what we call hyperarousal, high arousal, fight or flight, where there's too much activation. So we're talking about high anxiety, panic, ruminative worry, Or they get stuck in hypoarousal, too little activation that involves shutting down, numbing, dissociating, suppressing feelings in an attempt to dampen the jumpiness of their nervous system. And when engaging in EMDR therapy, the therapist helps the client to stay in their window of tolerance at all times. The therapist reminds the client over and over, just observe, just notice. It's old stuff. Be a passenger on a train watching the scenery go by. And if a client starts to get stuck in a high level of activation, hyperarousal, or they start to shut down, they can't effectively process their memories. So their therapist helps them re-regulate it as needed. It's part of the process that the therapist is keeping an eye on that window of tolerance to make sure the client is just exactly where they need to be. They're not falling out of their window with, high activation. They're not shutting down. It's that sweet spot that we're aiming for, and a skilled therapist knows exactly how to help, how to assist. It's really the EMDR therapist's job to make sure that the client maintains what we call, in EMDR, we call dual attention at all times. As Michael said, that the client maintains one foot in the present at all times while dipping one foot into the past. And that's really, that dual attention is key to safe and effective processing.
There seems to be a lot of trauma within our systems, such as our medical system, our hospital system, our school system, religious systems, the military. And these systems allow abuse to happen and, in some cases, actually encourage it. Um, and this can present itself in different ways. This is how racism develops, sexism, sexual abuse, things like that. What do you see in your practice, Dr. Korn, with clients who've endured systemic trauma?
Yeah. Well, racism, sexism, homophobia, and other systemic injustices affect identity and sense of worth or self-esteem. They affect one's sense of safety in the world. They affect one's sense of power and control. And they affect one's sense of connectedness or belonging. And marginalized individuals and groups often experience fear and hypervigilance, right? Headaches, body aches, self-blame, confusion, shame, and guilt, a sense of powerlessness. We look at all of these symptoms and domains in EMDR therapy. With my clients, I always ask about experiences of feeling different, feeling ignored or invisible related to race, sex and gender, religion, culture, and I inquire very specifically about the kinds of messages that they've received that have left them feeling alienated or inferior within various kinds of systems. And we explore for experiences of being misjudged, misunderstood, held back, harmed, or physically or verbally assaulted because of their identity, their race, their culture. And many come to recognize how these trauma-based beliefs and feelings and behavior patterns have been carried from one generation to the next. This systemic oppression, right? These systems that have been perpetuating these injustices really go back generations. And maybe the last thing I'll say is that in EMDR, we focus on both macro aggressions, like the big T traumas that, the kinds of experiences that anyone would consider a trauma, but also microaggressions. And we focus on what happened to people, but also what didn't happen, right? The lack of protection, the not being believed, the feeling invisible. And we make room for grieving and anger and fantasies of revenge and impulses related to fighting back or speaking up. We give people an opportunity to say what they never could say because the power differential never allowed for them to actually speak up or be heard. And we focus on the traumatic aspects of being oppressed or discriminated against or abused, but we also ask about and we listen for triumphs, strengths, skills, intuition that have been a part of surviving when you're not part of a dominant culture. And through the processing of their traumatic memories, through the honoring of their strengths, people come to appreciate their resilience and their survivorship. And eventually in EMDR, we set goals and we prepare for challenges in the future. Many folks come out of their experience in therapy prepared to speak up, to fight, committed to activism, hopeful about changes they can make in systems. In EMDR, we work on past, present, and future, right? That is the framework for the work where we clear out the old stuff, we work on the present triggers, the present limitations, and eventually we help people to imagine hoping differently, thinking differently, seeing themselves differently in the future.
Sometimes our society puts us in those positions where we are marginalized in that way. Other times, our experiences make us separate ourselves from other people. And in a different kind of a way, I think we're marginalized. So I want to kind of piggyback on that. Michael, you talk in the book about a memory that surfaced in EMDR that you had been the victim of abuse as a child in a medical setting. And we're aware that this is a sensitive topic. And if there's anything you would like to share with our viewers, especially men, that you think might be helpful, that you're comfortable with, we would appreciate it.
Yeah, actually, Lisa, one of the reasons why I wanted to do this book with Debbie was because I think it's maybe for whatever reason harder for men to, let's say, um, consider things or look at things or admit things to themselves, and then even harder to share them with other people. I don't think men are necessarily brought up to do that, and that was one of the reasons why I wanted to share this part of my story, which was started with a nightmare that I had for God as an adult for like 30 years, 30 plus years, the same nightmare over and over and over. And it was about being an accomplice of a murder, and my accomplice had already been incarcerated. And in the nightmare, the police have found out that somehow they've now confirmed that I was an accomplice, and they're coming to get me, and they're going to coming to get me to put me in jail, and I'll never ever ever get out. And I could hear the sirens, and they're coming after me, and this is going to be it. And I'll never ever get out. I'll be trapped. I can't get out.
That sounds like a nightmare.
Yeah, and and it was as terrifying the first time I had it as the last time I had it. And about three quarters of the way through the 2 year period with Dr. Magnavita, I had this dream again. It was the night before I was going to be driving up to see him. And what changed was the ending of the nightmare where I wasn't sitting waiting for to be apprehended. It was an office park that I could see and a doctor's office that I could see, and hearing a door shut, and hearing the white coat of the doctor, and hearing, the crumpling of that sort of waxy kind of paper that's on the examining table, and then hearing a belt buckle drop, and then this excruciating, unbelievable pain. And I was alone with this pediatrician. This is when I was in kindergarten and maybe first grade, and uh, this is a rape situation. And Dr. Megavita, I think he knew much earlier, but that was the first time I was allowed, or my subconscious was allowed me to see this. And that's what this nightmare was looping and looping and looping for decades in my mind about the situation. And it was quite remarkable at the time it happened. I'll never forget being in his office when this all thing, starting with the dream before. But then in his office, my body was, in turn, you referred to Dr. Bessel's book, Body Keeps the Score. It was a lot of body memory because it was just so, so, so painful. And, again, that was a part of the whole EMDR process for me. And that was one of two really serious traumatic events. One was a sexual one. This was too, obviously. And this one that got revealed to me through the course of the EMDR process.
I really appreciate you sharing that with us. Men, so many men go through this experience, as you said, and don't talk about it. They don't want to even think about it. And I think it's wonderful that you wrote about it in the book because other people reading this book, especially men, if this has happened to them, will see, and in listening to you today, hear that they're not alone.
No.
Um, and I'm curious, is this a memory that was repressed until that one EMDR session?
Yeah, and I think for good reason. I think
Yes.
it was just, and I remember do the process. I remember things that would be coming back. I remember dissociating into the colors of the flecks of linoleum. This sort of, I'll never forget this sort of pale gray and pale green flecks in the linoleum, feeling like I was just sort of falling into that linoleum to just kind of disappear from the experience that was going on at the time. But I think absolutely, and I think as I look at it now, understanding that my subconscious with the nightmare is saying, "Hey, there's something going on here. Hey, there's something going on here. Hey, there's something unresolved here. Here, there's something unresolved here," because it would never go away. And as I told you, one time, probably, I was in my 60s when this all happened. I had the nightmare again. I fell out of bed. I almost broke my wrist. I mean, this nightmare was terrifying every single
It's
time I would have it. I
for
mean,
30 years.
yeah, terrifying. And I think it's, saying there's something going on here, there's something unresolved here, there's something you got to take. But it took, it wasn't as hey, but three-quarters of the 2 year into the 2 years with Dr. Magdavita, where I guess I was ready because I remember driving up there that day thinking maybe maybe whatever it is so terrible, I'm not going to be able to deal with it or handle it or face it. That's how I felt going up there. And then it came out and it happened in that extended session that day.
And with that piece of work, Michael's phobias started to relinquish.
Yep.
Right? You
Well, for
talk
example,
about the
I mean, I was,
buoy,
yeah,
the
yeah,
buoys
I
that
was,
were on the wall.
I would wait until the clock hit noon in second grade when I lived in California because I couldn't wait to get out. I had to use the bathroom. I could not go into the boys' room and use a stall and close the door and pull my pants down, sit down. There's no way on earth I would let myself be that exposed and vulnerable because I didn't know it, but my subconscious saying, no, no, that perpetrator is going to come back and get you again. I would have to run home, 10 blocks. Luckily, it was only to my house because the alternative was completely anathema, completely, absolutely a non-starter, impossible. And through my adult life, once again, I figured this is just the way I am. Today, I think I'm like most people who see a public restroom as a convenience or a lifesaver, not as a phobic, experience that you're not going to get, involved with.
I have clients sometimes say to me that they want to do EMDR, but they're afraid to because they're afraid it's going to unearth some type of a memory that they've repressed, similar to this one or a different one. After this was realized by you and you remembered it, what did that feel like for you driving home?
So for me, Lisa, on many, many, almost every occasion, because I would go up for extended sessions because I was 110 miles away from Dr. Magdavita, uh, it felt like I had gotten two more quarts of lung capacity. I would take a deep breath. It was like I had two more lungs of lung capacity, two more quarts of lung capacity. And over the course of the 2 year period, the best way I can describe it is it was if I was allowed to trade in my worried, panicked, afraid, don't know who to turn to, anxiety-ridden operating system. I got to trade that in for a new one that was calm, not anxious, not fearful, not afraid, not having, sort of panic. And that was the aggregate effect of this work with this 2 year period, because I think I lived in that state of mind since I was a boy, since I was a boy. And it's a really exhausting way to live.
It is. So I'm hearing you say that little by little, you were feeling relief every time.
Extreme relief. And like I had never felt with because I had done talk therapy, I had done CBT therapy, I had done intensive short-term dynamic psychotherapy. I had done a lot. I'd been, 7 different therapists over 22 years, and this was like this was like nothing that I had experienced before, particularly as it related to that short and long-term relief that was so palpable, so remarkable.
That's wonderful. I read online about people attempting to do EMDR on their own through bilateral stimulation online or by reading books. I personally want to strongly discourage anyone from doing that because EMDR is much more than just bilateral stimulation. Dr. Korn, can you please explain to our viewers why it can be so dangerous to attempt to do this on your own without a therapist present?
Yeah. Well, I agree. EMDR therapy is not simply moving your eyes back and forth or following some form of bilateral stimulation. There are many critical components to effective therapy, and the therapist plays a very important role in the work. The EMDR therapist helps organize the treatment plan and really serves as a guide. And the therapist is at the client's side every step of the way, right? Addressing fears, offering reassurance and validation, cheerleading, helping clients stay in their window of tolerance within that optimal arousal zone. I explicitly say to my clients all the time, I'm right here with you. I'm not going to let you drown. I'm not going to get you lost. I'm not going to let you get lost. Um, we as therapists, we offer to bear the pain with them so they can process it and heal. We make sure that they are tolerating the process and that they're staying connected to the present moment at all times, witnessing and observing what emerges, not reliving the trauma. EMDR is not about reliving. It's about reprocessing. It's about redoing, not reliving. And, if the processing gets stuck at any point, the therapist steps in to help. So without the accompaniment of a therapist, there really is a risk that a client could activate a memory and become overwhelmed by it and unable to resolve it. And it could actually make things worse rather than better.
Yes, definitely. Michael, going back to you, comparing how you felt before EMDR to now post EMDR, what differences do you see not only in your personality, but in your life?
I would say, for me, it was, well, I'll give you some examples, and then probably the most dramatic example. Things about self-care, taking care of myself, having a refrigerator that had a jar of mustard in it compared to a refrigerator filled with food that I made myself. The quality and depth of relationships, friendships, um, the exploration today of romantic relationships, exploring possibilities with women. That's a pretty profound change. Um, Sharing more authentically than in the past. I think if you had known me, Lisa, when I was at the height of my advertising career, you would have met me and you would have had no idea of who this person was behind this facade. You would have gotten, you would walk away. It's sort of like, they always say that, half an hour after a Chinese meal, you're hungry again. He was like, yeah, I know I met him and I talked to him, but I have no idea who this person really is or what he's really like, because that's what I was. It was like a facade. It was a totally,
Mhm.
manufactured personality. Um, the most dramatic example I can give you, my brother was a bully. I was convinced I didn't want to have anything to do with him for life, ever. And we were estranged pretty much for, till I was, 60, 65 years old. No relationship whatsoever. when the book was about to come out, Dr. Magavita told me I had to let my brother know it was coming because I couldn't just spring it on him. There might be, some kind of legal exposure. So I reached out to him and he reached back like by a miracle. And he said, I don't care. You can write whatever you want to write about me in the book if it means that possibly we could have a relationship as brothers that we've never, ever, ever had. And by the way, do you think Debbie could recommend an EMDR therapist for me? Which she did. So my
Wow.
brother had his own EMDR journey with one of Deborah's colleagues. And for the last year and a half, we have had a Zoom call every single Friday, have not missed, maybe we've missed one. We have had one trip together last summer and one trip together the summer before that. Um, I would say he's maybe the most intimate relationship I have in my life right now. And this is 100% attributable to my EMDR experience, my journey, and the one that my brother went on. And it is a gift that that's priceless. That's priceless. I was just with him this weekend up at his house in Rhode Island, and it's just, I can't even tell you how incredible it feels just to be together, and it's so easy, and we're brothers. And early on, there was that period of, wait a minute, that happened to you, that happened to you. It was incredible just comparing notes because we both grew up in the same, disastrous family. Um, so, I would say that's my most dramatic example of, if you even can call it a dividend of this work that I did with EMDR.
That's really wonderful. All of this sounds like it's what really compelled you to want to write this book. Every memory does deserve respect, the good ones and the bad ones. Um, and ultimately, through a modality like EMDR, we can process those and reprocess those so that um, we're living more engaged in our present day, right? Any last thoughts you'd like to leave for our viewers today before we end our session here?
I'll throw one in. Uh, when I was in my 20s, EMDR had not been discovered by Francine Shapiro, so it was not something that was available to me. Today, people can go on to emdria.org, put in their zip code, and see EMDR therapists, in right where they live. So, having gone through a 22-year journey, having finally found EMDR for me, which had such a profound life-saving effect for me, I would just suggest to your readers, to your audience, that just not to wait. If they or someone they know and love are suffering, maybe not even having any clue why, like I didn't, don't walk, run, find an EMDR therapist, call them up, interview, talk to a few of them, see who feels comfortable, you feel most comfortable with, and start the process. Because it's just, if I had been able to do that when I was in my 20s, my life trajectory would have been, I'm convinced, profoundly different. I'd have probably, kids downstairs and people gathering, my own children, my own family coming together for Christmas. But I think it would have been profoundly different for me. So I'm sort of like the Jacob Marley of the therapeutic world, telling, shaking my chains, don't wait. I had to wait because it wasn't around. Today, you don't have to.
Very good point. You're right. Dr. Korn.
Um, I have two thoughts. One is I just want to be very clear to everyone listening that EMDR was originally developed as a treatment for post-traumatic stress disorder. But, 30 plus years later, we now know that EMDR can be used for every kind of problem, for anxiety and depression and eating disorders and addiction and pain and sexual dysfunction and you name it, we have a protocol, a way of approaching it with EMDR. So I just want to be really clear about that. And I also just want to say to your listeners, your viewers, I want to say, come as you are. You don't have to figure out things before you pursue therapy for yourself. You don't have to know why you are stuck or what memories you need to address. Bring your entire hot mess, your fears, your confusion, your hopelessness to your EMDR therapist, and together you'll begin to make sense out of it all. And you don't have to do it by yourself, right? When you step into EMDR therapy, you will have a guide, a helper, a partner.
Very good. Thank you so much to both of you for shedding information and insight onto this topic. Every Memory Deserves Respect. This is a wonderful book. It's written, I think, for the uh, average person who wants to just learn more about this type of treatment, and it has some really wonderful graphics and photographs in it as well. Thank you so much. Take care.
Thank you, Lisa.
Thank you, Lisa.
Bye-bye.